A couple of weeks ago, the wife of one of my patients found him lying in his own blood, face down. It was a dark pool of blood and had a lot of blood clots in it. It was very evident that he had vomited a lot of blood and collapsed in their dining room. So this was somewhere around 5:30 in the morning. She heard a huge noise from the other room and she woke up and found her husband lying face down unconscious in his own pool of blood. They have a 7-year-old daughter and she was also woken up by this loud thud. They stayed together with their aged parents, the patient's parents. They were in their 70s and they were staying in another room in the same house. This whole episode happened so fast that when she checked for a pulse, she could not actually get a pulse. And even though it was a very feeble pulse, she wasn't able to appreciate a good pulse. So she rushed to her neighbors who called an ambulance, and the patient was rushed to the intensive care unit through the emergency department at my hospital. So when I saw him in the intensive care unit, he was not conscious. The doctors in the emergency, they put a tube through his mouth into his trachea, that is the windpipe, which goes into the lungs to help him breathe. And they hooked him onto a ventilator that gave him enough oxygen to keep him alive and to bathe his blood, his organs with oxygenated blood, because he was unconscious and was not breathing at all. Now, as this was happening in the emergency, and you should note that the mother and the young daughter, they traveled with him in an unconscious state, and the father was the husband was in the unconscious state in the ambulance, and he was covered in blood, and there was this stench of fresh and clotted blood inside the ambulance. And this kid was she had to witness all of this. That had actually deeply affected her. So when I met the family and was speaking to them regarding the next steps in management and other plans for this patient, I could see that this child was kind of mute. She was just looking, staring blank into the space without any eye contact. I started talking to the wife regarding the happenings that led to this particular event. So it seems that this patient, this was not the first time he had actually been in this position. About a year ago, he was in a similar position where they were staying in another place. And he had vomited blood at that time, sometime in the evening at their home. And that was the first time when they took him to the hospital. The doctors there diagnosed him with cirrhosis. So cirrhosis is a condition where the liver shrinks through various stages. So the initial stage is something known as a fibrotic stage of liver disease. And as the fibrosis progresses, the liver gets deeply scarred. The regenerative power of the liver is lost, and the liver becomes shrunken and nodular. So there'll be a lot of nodules on the surface of the liver, and the liver is shrunken. And that is what we call as a cirrhotic liver. So essentially, a cirrhotic liver has permanent change to its structure, even though in the early stages, the functions are perfectly fine. So when you look at a patient with cirrhosis, when you diagnose a patient with cirrhosis, they either present to you with a complication. That is the first time that you actually realize that there is an underlying liver disease. So when they present with complications. So one of the most common complications that they present with is vomiting of blood. Some patients do not even vomit blood. They have massive internal bleeding, because of which they will pass fresh blood through their stools, or they will pass altered blood. So something that's a condition known as melena. So that's when you have black tarry stools, and it's so foul smelling, you can actually identify somebody with massive internal bleeding because you can smell this particular stench of clotted blood from a mile away. Being a hepatologist, a liver disease specialist, I have had the unfortunate experience of diagnosing patients with massive GI bleeds, gastrointestinal bleeds, just by entering the room and identifying the stench. It's a very peculiar stench, and I don't think any doctor would actually forget about this for a very long time. And I can still remember that smell as I am speaking to you. So this person was diagnosed with cirrhosis. The first time he vomited blood about a year back. So in cirrhosis, there are 6 stages, to simplify it. So in the first 2 stages, you will have features of cirrhosis. So when you do an ultrasound or you go do some blood tests, or the doctor examines you, they'll find features of liver disease on you, but actively there are no complications. So that is stage 1 and 2. And essentially in stage 2, something additionally happens. So in stage 2, as the liver shrinks, the liver pressure increases. And because the liver pressure increases, there are various changes that happens inside the body. So the increase in liver pressure is known as portal hypertension. So once portal hypertension develops, large blood vessels enlarge in the body, especially inside the food pipe and in the stomach. So these are known as varices. Other than that, there are blood vessels which again enlarge inside the abdomen. Those are known as collaterals. And then when they become more than 8 millimeters in diameter size, they are known as shunts. So there are these large blood vessel changes that happen inside the body because the liver shrinks. So, and this is a condition known as portal hypertension. Now, the clinical event that defines portal hypertension happens in stage 3. So that is the stage when patients actually bleed. And they'll bleed in these two forms. Either they come with vomiting of blood, or they come with passage of dark, tarry black stools, or they come with both. That is when the clinical complications of cirrhosis start in stage 3. In stage 4, patients present with fluid inside their abdomen. So they have massive collection of fluid in the abdomen. Sometimes a needle has to be put in and the fluid has to be removed to reduce the symptoms in these patients. So that condition is known as ascites. So it can be fluid inside the abdomen, or it can be fluid inside the lung. This is the fluid inside the lung part is known as hydrothorax. So you have either fluid buildup in the abdomen or the chest cavity, which defines stage 4 of cirrhosis. In stage 5, patients develop, and this is one of the main events, they develop liver failure. So in stage 5 is when patients come to us with jaundice. So they have clinically identifiable yellowing of the eyes, yellowishness of the eyes, and they'll have bilirubin levels on blood test above 3. So that is when you define it as clinical jaundice. So once clinical jaundice develops, the patient is in stage 5, which means there is initiation or the stage of liver failure has begun. Now in stage 6, patients do have complications, multiple complications of stage 3, 4, and 5. And along with that, they have extra hepatic organ failures, which means there are organ systems other than the liver that starts to fail because of advanced liver disease. So they'll have something known as hepatic encephalopathy, where the ammonia levels in the body increases and that affects the brain, and the patient loses their ability to think and function, and they'll become confused, they'll have altered behavior, and slow and steady they land up in a coma. That is known as hepatic coma. So that is the brain dysfunction. Similarly, the heart, the lungs, the kidneys, they can all get affected. It's part of the end-stage liver disease. So essentially, patients in stage 1 and 2, their management is pretty much simple from a doctor's point of view. They require management of the causes for their cirrhosis. So for example, if somebody is drinking heavily and that has led to cirrhosis, he has to abstain from alcohol use. And that actually stops the disease from progressing further and slows down the natural history of the disease. And thereby they remain stable for many, many decades. So that is basically in stage 1. In stage 2, because the patients have developed portal hypertension, you have to give some medications to reduce their portal hypertension, that is to reduce the liver pressures. So a group of drugs called beta blockers are given. Now in stage 3, when they actually bleed, they undergo various procedures to control the bleed. So this can be endoscopic procedures or non-endoscopic procedures. Endoscopic procedures mean they either go through something known as variceal banding, where the varices, the large blood vessels, when they burst and they bleed, through an endoscope, you put rubber bands on top of it and then close them out. So that's called as variceal banding. Sometimes these large blood vessels are inside the stomach where you cannot put bands. So in that situation, you either do something known as glue therapy. That is also through the endoscope. You inject a particular glue that hardens when it comes in contact with the blood inside the vessel, and then that hardened blood vessel falls off, and then the whole bleeding source is controlled. This can be done through additional measures also. For example, interventional radiologists can approach the bleeding blood vessel through an angiographic procedure, through the small blood vessel at the peripheral part, either through the leg or the neck vein. And then they go and embolize or put some chemicals inside or medications inside the blood vessel to clot the blood, and thereby the bleeding source gets controlled. So that is how you manage the bleeding complications in patients with cirrhosis. There are various advanced procedures, but then I think that's a discussion for another time. But basically, interventional and endoscopic procedures start when patients start developing bleeding complications in cirrhosis. Now, in stage 4, when patients develop ascites, that is fluid buildup in their abdomen or chest cavity, initially what doctors do is to put them on water pills, advise them to limit their salt intake, completely avoid added salt in their food. And that essentially reduces the liver pressures, increases the kidney function, whereby the water pills, the excess fluid in the body is thrown out of the body through urination. Good functioning kidneys are very much important in that aspect. So water pills and salt restriction leads to control of ascites or fluid buildup inside the chest cavity, which is hydrothorax. Now, in stage 5, when patients do develop jaundice, we have a problem. The problem is that the jaundice is because of liver failure. So the liver functions are deteriorating. And if it continues to deteriorate, the jaundice creeps up. Sometimes a simple stress, like a simple infection, can actually worsen the jaundice to such a great extent that patients suddenly go into stage 6, where they have other organ failures also. So stage 5 and stage 6 are very precarious because these are the patients who require liver transplantation. So the whole aspect of transplantation comes when patients do develop liver failure and not when you just diagnose cirrhosis. So in cirrhosis, there are stages where you need to apply only preventive care. There are stages where you need to apply interventional care, and there are stages where medications help control complication, and then there are stages where you need to actually make the patient undergo a surgery to help them live longer. So coming back to my patient, so he had his first bleeding episode about a year ago. At that time, he binged on alcohol and he massively bled. He was taken to a hospital. He underwent endoscopy procedures and he pretty much got stabilized. He underwent 2 or 3 endoscopy procedures so that the varices are completely banded and then eradicated. So everything was fine for about 6 months and he followed up well. Now, the most important part to note here is that if somebody has cirrhosis and they are in stage 1, 2 or 3, even in bleeding patients, we have seen that the liver functions can be normal. So you'll have a normal bilirubin, you'll have a normal SGOT, SGPT, that is AST, LT, you'll have a normal albumin. All these parameters can be normal even in patients with cirrhosis. So cirrhosis doesn't mean that your liver function has to be abnormal. It usually becomes abnormal in stage 4, 5 and 6, sometimes not before that. So this person, once his bleeding was controlled and he was doing well and he quit alcohol for about 6 months, he went and got his liver function checked in between and found that the liver functions were actually pretty good. No issues there. And he believed that his liver is perfectly fine and he started drinking again. So the drinking started off with a couple of drinks every week, which increased to almost daily drinking, and then it became drinking in the mornings also, and at some point it was just drinks and no food at all. Right before the day, he massively bled at his home in front of his family and collapsed. He had about half a liter of rum the night before he went to sleep. And this led to worsening of his portal hypertension. His liver pressures, it just jumped, probably because of that alcohol use. And that led to massive rupture of the blood vessels inside his foot pipe. And that led to him vomiting blood. Now, he lost about 4 liters of blood. So the human body contains about 5 liters of blood at a point. That's the total blood volume. And he lost about 4 liters of that. Now, when you lose 4 liters of blood suddenly and you collapse, a lot of things actually happened there. I mean, when I saw him in the intensive care unit, he was already on a ventilator because his airway had to be protected because he was not conscious. So the doctors put in a tube, hooked him onto a ventilator so that the machine will help him breathe. He was also unconscious and he fell down. So we did not know that if he had any brain injury at that point. But a CT scan showed that there was no active bleeding into the brain. But since he lost 4 liters of blood and the ambulance took about probably 10 to 20 minutes to reach the hospital because they live in the suburbs. By the time he was in the emergency, he was in shock. A shock is a condition where when you lose a lot of body fluids, especially blood, your blood pressure becomes so low that it becomes unrecordable. And then you'll have to pump in fluids and blood and medications to increase the heart rate and heart pumping so as to maintain the blood pressure. So this person was completely knocked off with that massive vomiting episode. And unfortunately, because he was vomiting massively and there was a lot of blood clots coming out of his vomiters, he aspirated a lot of these blood clots into his lungs. And this actually led to lung failure also by the time he was in the hospital. So the ventilator support was essential to keep him alive. Expectedly, something else also happened because once you lose so much of blood, every organ gets involved. So by the time he was with us, he already was in lung failure. He was unconscious and he was in shock. And because of which his kidneys were affected. His kidney functions went completely haywire. He was not bringing out any urine. The creatinine levels, which were supposed to be less than 1.2, his was 3.8 by the time it was evening, and he was bringing out hardly 5 to 10 ml of urine per hour. Even the liver was extremely badly affected. The massive loss of blood led to something known as ischemic hepatitis, where sudden loss of blood flow into the liver leads to complete destruction and damage of the liver cells. And that presents with very, very high levels of liver enzymes. So his SGOT, SGPT enzymes were in 10,000s by the time we saw him. We did a emergency endoscopy. We found out 2 massive areas of gushing bleed inside his foot pipe. We banded them. We have a very expert team of gastroenterologists who does advanced endoscopy. They immediately banded him, controlled the bleed. But then that 20-30 minutes that he was at home and the time he took to come to the hospital, a lot of damage had already been done. But then we did control his bleed. We put him on antibiotics so that, in massively bleeding liver patients, infections are the worst enemy. They just ravage the body and don't give us any time to work on the patient. So we put them on prophylactic antibiotics. That is antibiotics given before the contemplating or anticipating an infection that is going to come. So all of that was done in record time, and we waited for him to wake up. So 24 hours passed by, 36 hours passed by, 48 hours passed by. Even though we could reduce some of the blood pressure medications, his urine output never improved. We had to give him 2 sessions of dialysis to help his kidney recover. His lung functions did improve. The oxygenation requirements all came down on the ventilator. But ultimately, he was not waking up because probably his brain was also hit. It requires a lot of oxygen and glucose to function, the brain. So he went into liver failure, he went into kidney failure, he went into lung failure, he went into brain failure. All of this was brought on by a recent alcohol use in an already known cirrhosis patient, whose liver function tests were perfectly normal, by the way. So a perfectly normal liver function test in cirrhosis does not guarantee a healthy liver. Patients with cirrhosis can still have a normal liver test. So don't always bank on a liver test to be normal to say that you have a healthy liver. You can't. Now, almost 5 to 6 days on the ventilator and still no signs of waking up. We tried everything for this patient, and he did not have any medical insurance. And he had a small travel agency. They had a fleet of about 4 or 5 cars, and he did this with the help of his partner. And they had 2 or 3 taxi drivers, and they were managing the small business. And there was not much money because a lot of this money that they had in profits, he used to waste them on alcohol. So ultimately, beyond 1 week, beyond 10 days, the family found it really tough to keep up with the bills because he was managed aggressively in the ICU, and it is expensive to be inside the ICU undergoing advanced care. And at some point, when I spoke to the wife, and she had already turned into a zombie at that point, emotionless, having no feeling whatsoever. When I was talking to her, she would just stare at me. And it was like the decisions were from me and not from her. And I did not see the little girl. She was traumatized to see her father lying in a pool of blood and gasping in an ambulance on their way to the hospital. And I'm not sure if she would ever recover from those scenes. More so, she'll go into post-traumatic stress disorder. These are complications of alcohol beyond the person. So alcohol does not just damage or destroy the person, it actually destroys family, children, society, and everything around you. So it's got long roots, it's got long tentacles, and they never let go. So ultimately, there was a point where they had to crowdsource funds for continuing the patient's management in the ICU, but this man was not waking up. So as a doctor, I have to be practical, I have to be rational, I have to be aggressive with my patient treatment. So we were aggressive in him initially, and we did continue that aggression as much as possible. But now that aggression did not give us any result, it was time to think rationally and logically from not just my point of view, but from the family's point of view. So they were being drained financially, and there was no response from the patient that he is actually improving. So ultimately, I had to tell the wife that it was time to take a call whether we should plan hospice care, shift him for end of life care, continue comfort care, and take him off advanced support so that, at some point we can give him a dignified death. I think that was the time I saw her eyes well up with tears, but she did not cry because I think the whole 5 or 6 years that he was using alcohol, she has seen bigger horrors. And I think probably those tears were tears of joy. I don't know, because I think she was living in hell all this while, and now she felt that, this hell was getting cleared up and, it was going away and things are going to get better. I'm not sure, because I did not see a bit of grief or a complete paranoia in her, knowing well that her young husband was going to die. So he was 42 years old. That's it, 42 years old with a 7-year-old girl child. And ultimately, because she could not make a proper decision, her neighbors came, her cousins came, her brother came. Aged parents, we did not involve them because I think they've had a good long life and it's not right for us to stress them out more. They're already burdened with a lot of problems in the family, and having a son with alcohol use disorder, it was terrifying for them. It was terrible for them. So ultimately, all of these people came together and they decided that they cannot go ahead waiting for him to get up, because one, they did not have finances, and two, they were not sure that even if he did wake up, how long that recovery period was going to take, or if other complications were going to take him, and he's going to spend more and more days in the hospital because of multiple complications associated with his failing liver. So ultimately, we decided that, to take a call on the comfort care and end-of-life care, let us revisit his current status. And in that process, we repeated a CT of the brain and saw that there was a fresh bleed into the brain. So ultimately, he did bleed into the brain because of an ongoing failing liver. So once the liver fails, the whole clotting function of the blood goes for a complete toss, and patients can bleed from any point in the body. So he bled into the brain, and ultimately, and that was more so like a brain death, because there was nothing left inside his skull, just a sack of blood and some brain tissue. That was it. And that was a time when we really knew that, this man is unsalvageable and there is nothing we can do. And ultimately, they signed on the comfort care orders, and we put him on basic support. And I think in a couple of days, he passed away peacefully. We gave him a dignified death. We tried everything, but we lost him. Now, the mother and the child, they went back home. I think they went back home in the form of a shell of their former selves. They were not the same ever. Because the trauma that they went through those few weeks inside the hospital, and the trauma that they were facing even at home when he was continuing alcohol and was suffering from alcohol use disorder related behavior problems, I think all of that was deeply scarred into their minds. And I'm not sure how much they would ever recover, but they took his body and they went home. So cirrhosis is something that is pretty much very common among our community, and we diagnose a lot of cases with cirrhosis, especially with alcohol use disorder. And it's not that somebody has to be a heavy drinker to develop cirrhosis. I have even diagnosed patients with occasional alcohol use with cirrhosis because they have other additional risk factors like genetics, obesity, diabetes, etc. But to lose somebody so young to alcohol, to destroy a family, to traumatize a young child because of alcohol use disorder, I can't find the words to describe that. It's unforgivable. But then alcohol use disorder is a disease and people require treatment. For a whole year, he was being treated for the same. For 6 months, he was on de-addiction protocols, but then he fell back into the alcohol trap because he thought his liver functions were fine. And then that cost him his life. So please remember that sometimes a normal liver function does not really equate to a normal liver. It's different. People can have liver disease with a normal liver function. And second is that alcohol not only damages, destroys, kills the person with alcohol use, but also so many loving things around them, including children, a good family, aged parents, the society, the community, businesses, productivity, everything gets destroyed in its path. So I hope you learned something from this case that I had to discuss with you, to take it out of my chest also, because I see many of such cases every day. And I would definitely share more and more such instances where I feel that not just educational content, but there is some wisdom from all these cases that we can identify and learn from. So until the next video, I thank you for your patient listening. Take care and say no to alcohol. Bye.